Hey everyone, welcome back to another episode of the Brawn Body Health and Fitness Podcast. I'm super excited to welcome Dr. Meghan Rohde onto the podcast today. I've had the pleasure of knowing Meghan for about two and a half years now. I met her when I was on a clinical out in Arizona, and she was very much an early influence onto my entire physical therapy journey thus far. She is an absolute savage alpha individual, and you're going to hear a lot about that in the episode today. But you're also going to hear about another side as well. And, ultimately, a lot of us, myself included, we like to kind of come off as, just for lack of a better way to put it, an absolute badass. But sometimes we struggle with things, and sometimes we go through difficult times. And ultimately, those are the things that make us better and move the needle of life forward. So we kind of dive into a lot of those different points and stories along that journey today. So I know you're going to love this episode. I highly recommend you check out Meghan's Instagram account at itdependsdpt, and I also recommend you follow her other Instagram account at Forrest Matram, for all of the amazing stuff that she's continuing to do. Enjoy the episode. Meghan, welcome to the podcast. I'm super excited to finally get you on the show. It has been years in the making here.
Absolutely. I'm excited to be here. Thank you.
So for people who might not be familiar with you and all the incredible things that you've done, across your career, would you mind filling them in a little bit about who Meghan Rohde is?
Oh, goodness. Well, I guess first off, I'm a wife and a mom. So I have I call them my two Forrests. So my husband and my son are both named Forrest. Forrest and I have been married. This summer will be 7 years, or this fall will be 7 years. We've been together for 10, and then our son is 5. And then now I am a program director in a PT program. I work for Franklin Pierce University. I've been with them since 2014. Prior to that, I was just a good old-fashioned orthopedic and sports PT. Dabbled a little bit with some high-level athletes. Did quite a bit with female athletes, pregnancy, postpartum. And then recently, I would say over the last, maybe 5-ish years, I've gotten more into trauma-informed care. And now I'm kind of branching out into trauma-informed education, because I think our students come in with a bunch of junk that we're not prepared really to handle. So I love CrossFit. I love Olympic weightlifting. I'm actually coaching today, so I don't know if you do video with this, but I've got on my CrossFit Sauhegan shirt to go coach. And yeah, I've been doing CrossFit since 2011, and Olympic weightlifting actually since I was 13. So yeah, that's pretty much me. I love to be outside. I love to get my feet in the grass. We were just talking about camping and glamping across the country, and so anything to do outside, but I also am a city girl at heart. So my husband has to take me into Boston at least once a month so I can get my city fix.
There you go. And, I think you really just scratched the surface there too, Meghan, because you have accomplished so much and done so many different things, whether you look at it from a professional lens or a personal lens. And really what you've done is incredible. Just to stop and think about some of the athletes that you've mentioned that you've worked with in the past, the career that you've built for yourself. I think you've got, 2 or 3 doctorate degrees technically?
I have 2. I've got the entry-level DPT that I actually had to get afterwards because I'm old enough that when I graduated, it was still a master's level. So I went back in 2010 and got my transitional DPT from the University of Montana. That was an awesome program. With some really big names in PT associated with it. So it really kind of was a springboard. And then when I joined Franklin Pierce, I wish I'd kind of negotiated this a little bit better. They said I needed to get a terminal degree, so meaning a Ph.D. or a DSci or EDD or something like that. And I was like, cool. Well, I thought I would do that anyway. And so I just went off and did it. And, unless President Biden and the Supreme Court really get their shit together, I got to start paying for that in the next couple months. So yeah, I finished my PhD in human and sport performance in 2020. I actually defended my dissertation on March 2nd of 2020 in Portland, Oregon. And I was on a plane that night back home to Phoenix. And sure enough, 2 days later, I was sick. I was the sickest I've ever been in my life. And then 2 weeks later, the world shut down. So I remember I was sitting next to a lady on the plane and she was coughing. And I was like, I bet she's got whatever this COVID thing is. And I'm probably going to get really sick. And sure as shit, I was so sick. Yeah. So that's where those 2 doctoral degrees came from.
Impeccable timing, as always.
Impeccable timing. Yeah.
You know, I think we've talked in the past. I know I mentioned it when I was working with John Hasdevac there in the past. You know, I've had the privilege of getting to know you a little bit in person and see how you work in a clinic on a functional, like day-to-day type thing. And, you know, I still hold true to my statement that you're probably the most alpha, savage, whatever term you want to throw at it, PT that I've ever met and worked with in the past. But, you know, I can't help but wonder, Meghan, there's probably another side to that. You probably weren't always the fearless, confident, I'm going to do this and it's going to work kind of person that I came to know you to be.
Absolutely. I was not like that. When I first graduated from PT school, my first job was with Concentra Medical Centers. And I took the job because they paid the best. And I was really nervous about my student loans. For context to new grads that might be listening, my starting salary was $55,000 a year. So, you know, we've gotten a little bit better, I think. But, you know, for people who don't know about Concentra is primarily occupational medicine. And so you have a schedule, but then you also have walk-ins that you'll take, you know, for people who get brought in with injuries and stuff like that. And in Oklahoma, I graduated from the University of Oklahoma, fantastic PT program. I'm still in touch with some of my professors there. Absolutely love it. So in Oklahoma, you can work as a graduate PT under a PT's license, and they just have to co-sign your notes, kind of like, you know, when you're a student. And so the day I passed my board exam, I went to work and I was like, sweet, I get to do this on my own. And my first patient that I saw had no social security number, did not speak a lick of English, and had acute low back pain. And I was like, oh shit, I have no idea what to do. I don't speak Spanish. At that point in time, I was terrible at spine. Like, give me anything extremity, but spine really freaked me out. And this guy's in like 9 out of 10 pain, like almost in tears, can't move. And I was like, I don't even know what to do.
You mean to tell me school didn't prepare you for that, Meghan?
No, it did not.
I'm
shocker.
shocked. Wow.
I know, shocker. So I went and got my boss who was fluent in Spanish, and she was wonderful. She was so great. And she came over and translated for me. And I just did my best. And the guy's pain didn't change. And I think he was actually crying as he left. And as soon as he walked out of the clinic, I started crying because I felt like such a failure. And she was like, hey, you just treated your first patient 100% totally by yourself. Like, all she did was be my interpreter, but the clinical decision-making was all on my own. And I was like, huh, no kidding. Yeah, I guess I just did that. So, and he you know, Concentra's model was that if people got hurt that day, they would come to PT 3 days in a row, and then they'd go see the physician again. And so he came in the next 2 days. He taught me some Spanish. The next day he came in, he felt better. I ended up seeing him for about a month, and it really helped my confidence. I didn't make him necessarily worse. I didn't make him better. So that was a hard pill to swallow. But it was okay. And so I just kind of kept on with that. And I lasted with Concentra maybe 6 months. And then I switched over to Health South before they went under. And I think my evolution, I can really attribute to the mentorship that I had. You know, my boss at Concentra was wonderful. And then the people I worked with Health South were really wonderful too. And then about 3 years after that, I had a great opportunity to go and work for Cleveland Clinic. And that really just changed everything. And I was terrified there too, because if you're you're working for a hospital system like that, you know, typically you are seeing people, eventually you'll end up seeing people who have tried everything. Like they've seen the PTs, they've done chiropractic care, they've seen the surgeons, and they still aren't getting any better. And you're like the last resort. And that's a lot of pressure. And then, you know, we did do some things with the professional sports in Cleveland. And so sometimes those guys would come in. I remember the first time I worked with a professional athlete, I was terrified. And one of my friends said, he's just another person. Like, he's got a lot of money. He's got a lot more money than we do, but he's just another person. And that perspective kind of made the difference. And so it was just, you know, one day at a time, just chip away, and try to learn and absorb as much as I could from everybody around me.
Right. And, you know, it seems like you're kind of alluding to the fact that everyone had different perspectives on the same situation, right? So going back to your example of the first patient you treated, right? Your boss at the time thought you did a phenomenal job. And meanwhile, you're sitting there in tears, like, I can't do this.
I'm a total failure. I can't do this. Yeah.
Right.
Yeah.
And, you know, I think it's so easy, and so often we find ourselves getting caught up in the moment in a situation like that, looking at the immediate things that we just did or saw or whatever, and assuming the worst from that. You know, we always assume that it was something we did, or that we didn't do the right thing, or we reflect and we say, oh, you know, maybe I should have done this instead of that, or whatever it is. Like maybe a PA mowed this guy's spine, and, you know, maybe you should have needled his paraspinals instead. I don't know. But, you know, at the end of the day, those are the only things that move our needle of life forward. And I'm sure that's something that you came to recognize very, very shortly after, especially with your work in the Cleveland Clinic, working with, you know, professional teams like the Cavaliers. I mean, plain and simple, if you can't develop the ability to look back at, you know, whatever you did that day and say, you know what, I might have sucked for 5 minutes today, but that's okay, because now I'm going to get better next time, and I'm going to learn from it and start to look at the brighter side of gray. I mean, that's what makes you so effective, in my opinion, is your ability to do that. But for some reason, that whole memo is completely missed in today's day and age. It's almost like we demonize failure, and we settle for nothing short of perfection in all that we do. And, you know, that sparks a whole nother conversation of just the paradigm of perfection, right? Like, what is perfect to me is not perfect to you. So I like to say that things are always imperfectly perfect, if that makes sense.
Yeah, for sure. I think, you know, the way I was brought up, my dad is a retired general in the Army. My mom is a retired psychologist. I'm an only child. So I was kind of screwed from the beginning, right? You know, high expectations, a little bit of psychoanalyzation. And it wasn't, I don't think my parents really ever said it has to be perfect. They really pushed me. And there are some times that I get really super frustrated about that, because I think it contributed to a lot of the issues that I've worked through as an adult. But at the same time, I think about where I am, and I don't think I would be here if they hadn't pushed me. But perfectionism can really, really damage us, because we, you know, like you said, we get this idea in our heads of what perfect is. And so, especially, I'm gonna soapbox for a minute. You can tell me
Go
to step
for
down.
it. Go off.
I think for women, we have this societal perfection that just screws us from the get-go as kids. Now, I was born in 1980. And so I grew up with Barbie dolls and skinny, you know, late 80s, early 90s models. I thought Kate Moss was like the most amazingly beautiful person growing up. My grandmother loves to shop, and she used to bring me, I grew up in Oklahoma, so kind of a southernish way of living. And she would bring me the Neiman Marcus catalogs every time she came to visit. And so I grew up seeing like these beautiful models and these beautiful clothes. And for those of you who have physically seen me, I am not built like that. And I started weightlifting when I was young. And so like this whole thigh gap thing, I never had a thigh gap. And I remember as a teenager looking at my friends who were cheerleaders or ran cross country or whatever. And they're these like skinny, lithe little girls. And I'm like, my dad used to say, built like a brick shit house. Like, you know, you're not knocking me over. and I hated it. And so I would change the way that I stood or the way that I dressed so that I could look like that, because I thought that was perfect. And now at 42, it took years of CrossFit, years of therapy, having a baby, and having a husband who thinks I'm just wonderful the way that I am, to finally be at home in myself. And I still struggle with it. And so then I think that compounded with what we do to students in PT school really was a recipe for disaster. So if you think about lab practicals, there's a rubric. You need to hit the marks. It needs to be perfect. Your hand placement can't be 10 degrees off. It's got to be right there, you know? So you got 3 years of perfection in PT school, and then you go into the clinic and you got to do that. And, you know, patients are expecting a lot from you. So it's really easy to get into this like perfection way of thinking, only to find out once you've, you know, have the aha moment that everybody's so damn worried about themselves. Like they actually don't care about you and whatever's going on. So, and it's, I think patients really would rather than you be perfect, I think patients would rather you say, you know what, I'm not sure, but I will look it up and get back to you, and then follow up after you look it up and get back to them. They would rather that than perfection.
Yeah, I completely agree. I mean, at the end of the day, I found that no one likes the know-it-all.
No.
I don't care if we're talking about the school sense or the life sense. No
Yeah.
one really likes the person who always has an answer for everything, no matter how ridiculous it is. And I've found over the past year of, you know, my own life here, that there's a lot that, you know, school preps you for, but there's so much that it doesn't. And you getting stuck in those what the hell moments, what you do to answer them is really what I think defines your character and defines what others will view you as far as a professional goes. So, you know, if you get stuck in one of those moments, you just clearly kind of jabber on about some random answer. Like people can smell insecurity a mile away.
Oh, for sure.
Whereas if you just kind of say, look, here's what I think I know. And I like the term think I know, because believe it or not, we don't know everything, and not everyone agrees on everything. I've seen, you know, world-renowned surgeons go back and forth over which graft to do for an ACL reconstruction. We've been doing that procedure for decades, and yet we can't all agree on what the best answer is. And that's okay. So it's okay to say, here's what I think, and here's what I'm going to do about it. You know, you can research it. I like to jump on the phone and just call other doctors and providers and kind of build in like a second opinion, for lack of a better way to put it. I mean, the sky is really the limit on what you can do in that situation. And ultimately, if you show someone that you care about them, they're going to respect that. You know, I don't think anyone really cares about how much you know until they know how much you care. I think that's like a cliche term or something like that.
Theodore Roosevelt said that. Like he was one of the, I mean, he had his flaws, but he was one of the best presidents. And he coined that phrase, no one cares how much you know until they know how you make them feel. And I think that, you know, one of the things that you said a minute ago made me think about this in terms of perfection. You're talking about moving the needle. If you look at like compounding your day, like over the period of a year, if in one day you move the needle 1%, and you do that every single day for 30 days, you've collectively moved the needle 30%. And if you do it every single day for a year, you've improved 365%. And so I think people get so stuck on making these big changes that you don't actually have to do that. And that's where I think failure happens when, think about it like in reference to a diet or a nutrition plan. People will say, I'm going to start my diet on Monday and I'm going to eliminate this food group, or I'm going to cut down to 1,500 calories, or, whatever their thing is. When maybe if they just started going for a walk for 15 minutes after dinner, don't change the way you eat, just go for a walk and do that for a month. Okay, great. Now I have this habit and I've moved the needle 30%. Okay, now I'm going to not have my glass of wine at night, which would be really sad for me to let go of. But, so little things. And I think as PTs and as students, I really encourage students to think about that. Like, you don't have to know everything every day. You just have to move the needle 1%, So like my first year students, when they come in, our first term is 12 weeks long. They've got 6 credits of anatomy and 6 credits of kines. And it's like hell for them. It's so overwhelming. Well, just go home and like look at something every day. Just spend a little bit of time with it every day. And don't forget time for you. And then just move that needle. And then, over time, we see this really great improvement. So I think keeping it simple really, really helps to do that.
Yeah, no, I completely agree. And, we've mentioned the concept of failure a few times here. And as you were talking, you brought up the point of, it's okay to learn how to fail forward. But
for sure.
At least from my own experience working with this population, I found that individuals that come from a military background have a very difficult time with failure because most of the time in the military, failure of a mission or something along those lines usually means someone is not coming home. So failure is not an option there. And you mentioned that you grew up in a household where your father was, a general in the Army. So how did you go from, what I'm assuming to be a belief system of failure is not an option to the point now where you're able to fail forward and encourage others to do the same?
Well, I think I have to be really, I have to give credit to my dad, really. It wasn't necessarily that failure wasn't an option. It was this ability to reflect and answer the question honestly, did you do your best? And your best is what is going to change from one day to the next, right? Did I sleep well? Did I eat well? Do I have, other emotional baggage going on? Am I stressed out about something? Whatever it is. And anytime I failed when I was growing up, I would, if I went and talked to my dad, he would listen. Now he would only listen to a point, and then he would say, okay, enough's enough. And then he would ask me, did you do your best? And if I could honestly answer that question, then typically it was okay. The hard part was my own kind of self-deprecating way of thinking, because I would say, well, my best could have been a little bit better. So I was super hard on myself. And I don't think that my parents really created that. I think I created that for myself. But I had a period of time where that didn't happen anymore. And then when I met my husband, he actually introduced me to Jocko Willink. And how much I love Jocko and Echelon Front. And the very first thing that I ever saw was Jocko's video. It's on YouTube. It's like 2 minutes long and it's called Good. I now play it at the beginning of every single academic year for my students. And basically what he does is he goes through and talks about ways that we fail, didn't get the equipment we wanted. Good. Didn't get the raise. Good. As PTs, our patient didn't get better. Good. I failed an exam. Good. I failed a practical. Good. There's always, if you can say what he says at the end, if you can say good, it means that you're still alive. And your job at that point in time is to get up, dust off, recalibrate, re-engage, and go out on the attack. Thank you also to the class of, I think, 2018. They bought me a good mug. It is one of my favorite mugs. I should have actually had it today, but I have my M mug instead. But I think that's part of where you make that shift to fail forward. If you can say good, and you can really look back and figure out, like, what did I do wrong? Then, or not necessarily wrong, what could I do differently? That's what we do with our son. You know, when our son's 5, he messes up all the time. Once he can calm down, we'll sit down briefly, because you can't talk for a long time to a 5-year-old. And I'll just say, what do you think you could do different next time? And just that question gives him the opportunity to kind of think about, you know, next time, maybe I will wear shoes on the stairs. He fell down the stairs the other day, like just slipped and like slid down on his bottom. But, you know, things like that. And so as PTs, if our patients don't get better, is it a them problem or an us problem? Because there's two people in that relationship, right? You know, as students, if I failed an exam, good. Okay. How could I do that differently? Did I go to office hours? Did I ask the right questions? What were my study habits like? You know, was I studying with, you know, freaking Schitt's Creek on, which is one of the best shows ever? You know, or was I studying with people, and that's not a good way for me to study? I love it when students come in and they're like, yeah, I rewrite my notes. And I'm like, sweet Jesus, why? It's like such a time suck. Let's talk about that. You know, so if you can say good, then you have the ability to self-reflect and you have the opportunity to learn something. If you can't say good, then like we've got a bigger issue.
No, I completely agree. And I love that you bring up that specific little mini speech or mini podcast clip from Jocko there. It's one I'm very familiar with myself. And I found that it's become easier to say the word good after some type of failure coming up short. However, there's sometimes where situations happen that you just kind of look at, and there's a lot of denial and anger that goes on. And it's very difficult to find the brighter side of gray in certain situations. You know, give an example, a patient I'd been working with for a long time came in just a few days ago and had an acute injury. Sent that individual to someone I know at a walk-in clinic who unfortunately confirmed a fracture. So keep in mind, this was someone who had battled for a long time just to get back to where they were. And unfortunately, now there's another hurdle that was not foreseen, not expected, and it all just kind of happened within a 24-hour time span. It's very difficult to stop and look at a situation like that and say the word good. It's very difficult to find that. Absolutely. But somewhere deep down there is something good that will come out of it. And it's kind of hard to find that at first when you're restricted from doing the activities that you love for a period of time, and your whole way of life and lifestyle gets interrupted by something, you know, that just up and happens like that you had no time to prepare for. Not, you know, you didn't even see it coming. It really shocks the system. And I know that you have some similar situations like that, where things just sort of hit you one day, for lack of a better way to put it.
Literally, I see where you're getting with this.
So how were you able to, you know, go from alpha savage Meghan freaking Rohde, who deadlifts and power cleans more than even I can, to all of a sudden you see an MRI result and you're like, I think I'm going to need to go under the knife here.
Yeah. Oh, well, it was really freaking hard. So I guess I'll start at the beginning. We had just come home. We'd gone to see my parents out in Colorado for Christmas and decided to stay a little bit longer. I had a ton of PTO. So I was like, you know what, I'm going to take the first week in January off and just kind of slow roll my way, you know, coming back to campus. And we had left our dog at my in-laws' house, and my husband he's Air National Guard. And so we came home, and then 2 days later, he had to go on guard duty. So my son and I were in the car on our way to go pick up the dog after school. And it was, this is my first winter in New Hampshire. Now, mind you, I have driven in snow before. So this is not an inept woman driving in snow. This is shit New England roads. And we lost control of our car and crossed into oncoming traffic. And there was a car coming down the hill going pretty fast. And they hit the, really, I don't know, it was like 45 degrees off being a head-on collision at probably about 35, 40 miles an hour. Spun our car around, airbags deployed. And like the minute I realized I could not control my car anymore, I just said, Lord, I don't care what happens to me. I need you to keep my son safe. That's all I care about. And ask and you shall receive. Airbags deployed. I think it freaked him out a little bit. I looked back to check once everything had stopped. He was fine. He cried a little bit. I think he was scared. And then I got out. I said, okay, I want you to stay in the car. And I got out, ever the healthcare provider, to make sure the other guy was okay. He was fine. And so then I went to go get my son out of the car, and I couldn't open the door except for my door that was already open. So then I started to panic a little bit because the car had totally shut down. It was smoking everywhere. And I was like, oh my God, my car's going to explode and my kid's in it. So I had him unbuckle, crawl around to the front, got him out of the car. Another person had pulled over in a pickup truck and it was cold. And I said, can I put my son in your truck where it's warm so that I can get, his coat and stuff? And so he went and sat in this guy's truck. Like these people that just came out of nowhere. I mean, there was so much, God was everywhere when this was happening. Like, that's just kind of the way it was. So I called my husband, and I said, you know what, honey, I'm fine. I want you to know I'm fine, but I totaled our car, I'm pretty sure. And so I told him what happened, and he's a firefighter EMT. He said, you need to call an ambulance. I was like, no, I don't, I'm fine. And he said, no, it was absolutely an adrenaline trauma response. And he was like, you need to call. So called, went to the hospital. By the time I got to the hospital, I realized how out of it I was. And so I had a pretty severe concussion. But they didn't take any films of my neck. And I was too out of it to spout off the Canadian C-spine rules, which I knew I met all the criteria. And my friend was there. She works in IT, so she didn't know what to say. And, my son's playing with rubber gloves that are inflated like balloons. And then they sent me home. And so the next day, a friend of mine came over who is a PT, and I was like, my neck feels super stiff. Can you just do some soft tissue? And so I kind of told her a little bit about it. And she said, you know what? I love you. I'm not touching your neck. You need to go get filmed. So I went to urgent care in the little town that we live in, freaked them out because I was concussed. So I laid down on the lobby floor and just fell asleep while I waited for 4 hours, to get imaging.
Wow.
Yeah. Finally got taken back, got imaging. And I was fully expecting them to be like, you're fine. You just got your bell rung a little bit. Your neck's going to be a little sore, go do some PT and, you'll be good to go. And the guy comes, the doc comes back in, and he said, and he's got a Philadelphia collar with him. And I was like, what the fuck is that for? I don't need that. And he pulled up my x-ray, and my C6 was subluxed posterior on C7. And I was like, okay, well, that doesn't look good. And he said, yeah, it doesn't look good at all. You need to go get an MRI. Well, I live in rural New Hampshire, and it was 8:00 at night, and there was no MRI open. And so he said, we can transport you to the hospital, and you can spend the night and get an MRI first thing in the morning. And I was like, no, I'm not spending the night in a hospital to wait for an MRI. So I left against medical advice and with my cute little Philly collar, and went home. And my friend was with our son. She absolutely saved us that weekend. I went home and I cried, and I had a glass of wine, and I took off my Philly collar and I went to sleep. because I was just in denial, like totally in denial. So the next day, went to the ER, had my MRI. Turns out it was okay for me to take my Philly collar off, which was good because I'd already done it. But I had a complete anterior disc explosion. So C5-6 disc had completely blown out anteriorly to both sides. And so they referred me to neuro. And so a couple of days later, I walked into the neurosurgeon's office, and he did just a routine neuro exam and then pulled up my images. And he was like, why don't you try PT? And I looked at him and I said, I'm not a neurosurgeon, but I know imaging, and that doesn't look good. And he said, yeah, no, it doesn't. But I want you to try some PT for about a month. So no lifting, no pull-ups, no running, no jumping, pretty much no nothing except walking. And so then I went to PT. I had a great physical therapist. She did a lot of myofascial work, and it just kept getting worse. My right arm, I felt like numb, tingly, and this sensation of cold running water going up and down my arm, which in 16 years of being a physical therapist, I had never heard anybody describe that before. And I was like, what the hell is this? And it was just my right arm. And over the course of 4 weeks, it got so bad I couldn't even push open a heavy door. I couldn't hug anybody. If I hugged someone, my right arm would just shake. It was hard to pick up my son. And so I went back to the neurosurgeon, and he was like, yeah, I think you're a good candidate for a disc replacement. And I was like, okay, well, I'm going to go get a second opinion. So I went down to Boston and went to Brigham, and managed to find the guy who was part of the initial clinical trial about 10 years ago that got this disc FDA approved. And he's on staff at Harvard Medical School. And I was like, and he's the chief of neurosurgery at Brigham. And so I thought, okay, if somebody decided that you can teach at Harvard and you're the chief of neurosurgery, then I guess I'll let you cut on me. And oh, by the way, you've got like 17 publications in PubMed on this. So March 1st, I had surgery. They went in, did an anterior approach. I have an M6 cervical disc. So, it's pretty cool. Like the actual disc is made out of silicone, and the end plates are like titanium, but the top of them are like titanium Velcro. So there's no like drilling or anything like that into the spine above and below. It just like that grittiness kind of sits on the vertebral body of the segments above and below. And then over time, because our bodies are amazing, you kind of build up that new bone, and then you've got a nice new disc. So I am, let's see, today's Monday, May 8th. I am about a little over 2 months out. So yeah, that's how that happened.
And you're doing awfully well for being over 2 months out at this point, from what I've heard.
Yeah. I think honestly, like from the time of injury, I mean, it was 2 solid months from, January 6th when I was injured to March 1st, before I had surgery. The worst part of it was my concussion. It was my 7th that I've had. And I don't remember, no pun intended. I don't remember the other ones being so bad. But I had like crazy mood swings. I was super irritable. I feel really bad for my students and my faculty, because any decision that I made during the month of January and February, I don't actually really remember a lot of it. And then just, like you said, kind of what led us into this, not being able to do what I wanted to do. Like I couldn't do anything. I was relegated to walking and the Peloton. And, no, I'm not bagging on Peloton, because that shit can get really hard too. But, my concussion really limited what I could do. If I got my heart rate above like 130, my head was just pounding. And it was like that for 6 weeks. So yeah. And then the first month after surgery, I couldn't lift anything over 10 pounds. I wasn't supposed to bend over. I was supposed to just walk. And so then when I went back after that first month, and they said, you can kind of do whatever you want within reason, like let your symptoms really guide you. I tried the next day, actually, I was like, okay, I'm going to squat. And so I loaded up a bar and was squatting. I mean, I was only squatting like 145, but it felt good. Like I was like, okay, this is good. I feel, like I could start moving again, like move that needle 1% each day. And now last week I did pull-ups in a workout for the first time. I am doing really light snatching, really light clean and jerks. I'm able to squat heavy again, deadlift heavy. My bench is coming back. So like things are coming back, but that period of time, and I realize it's not that long. Like we're talking 5 months, really from injury to today, but it felt like forever. And so it gave me a whole new perspective for people who have, think about like our ACLs, like that's a year-long process, really, if you do it right. It's really hard when that happens because you have plans. Like we all have plans. I actually, I've been working with Invictus out of San Diego for a couple of years now. And my coach and I had just kind of revamped what my training was going to be like this year. And the day before my accident, I had just got my new training cycle from him. So I was like super jazzed to do that. And then like literally everything stopped. I think the biggest thing that I learned from this though, I had, my strength saved my life. I had a pretty significant bruise on my spinal cord and had a slight case of posterior cord syndrome. And if I had not the strength that I have, I would probably have a C5 spinal cord injury. So
Yeah,
that was crazy.
I would say so. I mean, first, Megan, thank you so much for your transparency and openness and honesty with everything, because I realize these things can be a little bit difficult to talk about and relive from time to time. And, some of that is normal. Earlier today, I had someone post-op ACL who was day one acceleration, deceleration. And believe it or not, he wasn't quite as quick as he thought he was going to be. And that can be a frustrating time. Completely different scenario, but just illustrating the point that sometimes we get to that point where it's 4 months, 5 months, however far out from, surgical date or injury date, and we still aren't there yet. And that's okay. And it's okay to be frustrated or caught off guard or even sad at times based on some of those things. And I think that, in general, providers do not do a good enough job of validating those feelings that develop after something that occurs like that. Because, I myself, knock on wood, I've never experienced what you have. I've never experienced what many of my patients have. And fingers crossed, I'm trying to keep it that way, at least for right now. The second piece I'll kind of throw in there as well is, you mentioned that you were able to focus on what you can do. Mm-hmm. And that might not have been easy to do in itself, because I know you're a barbell junkie. And I know things like, yes. I know things like a Peloton bike or, TRX straps or whatever that way are nowhere near as attractive to you as the barbell.
No, my barbell is like, it's beautiful. Like, that's my girl,
You would be the kind of person to carry your own into a commercial gym if you had to.
I have done that before, actually. I have done that. Yes.
That's too funny. And, to your point too about, strength saving your life, I bring up the mental, emotional side as well, because I realize that can be a very difficult thing to process in itself. Like, if I didn't do what I had done for the past, few decades, I would be living a completely different life right this second. And that can be very difficult to process, but it also reiterates that point that we talked about very early on in here, in that the things that you do day by day might make 1% of a difference.
Right.
And you might not ever get to see what that 1% of a difference looks like. Or maybe you do, and that 1% ends up saving your life. So it's important to, going back to what we talked about earlier, develop those skills and habits. I've heard people coin the term high performance habits, if you will, things like exercise, sleeping right, taking care of yourself, taking care of those around you, developing yourself personally in all facets, because those things long term over time repeated end up compounding into something that can have just an intangible effect overall on your life.
I think they do. And I think in the spirit of full transparency, I have to admit, I have a temper. Like I have always had a temper, and that concussion magnified my temper so much. And it not only magnified my temper, but it also, I was very, very depressed. And I didn't want to take anything. Like I'm literally trying to let my brain heal. And I felt, I don't know that I've ever felt so not myself. And my poor husband, that man loves me so much because I gave him every single reason during that time period to just walk away. Like it did not take much to piss me off. I would let everybody know about it. My poor son, like he saw me completely fly off the handle. And I think that, and I share that because one, I want people to know that I think Rage Against the Machine said your anger is a gift. And they're right. It's how you display it that's the hard part. And what that period taught me was that if I have this support system, which I do with my friends and my husband, before I started to feel like things were really coming off the rails, I could have gone to him and said, like, I don't know what's going on. I just know that I don't feel good. And he would have helped me. But again, to go back to what we talked about at the beginning, I went, it's so easy to slide back into old habits because they're comfortable. And my old habit of being perfect, right? And trying to be like this perfect wife and perfect mom. And, I'm going to heal perfectly, made me get really, really hard on myself. And then I would get really depressed because I couldn't do what I wanted to do. And then I would get really angry, and then I would take it out on my family. And it didn't take much to set me off. And it was only when he and I sat down and he was like, look, you can't do this. You can't get so angry with me that you're like threatening to rip down the Christmas tree and telling me to pack my shit and get the fuck out of the house because you don't feel good. Like, I'm here to help you. And that vulnerability and like really leaning into that discomfort helped get me through some of that. So then I could go to him and I could say, I feel really terrible. I did a Peloton and I feel like I'm going to throw up because I got my heart rate up too high. Or, I'm sick of walking. I miss my barbell. I miss the gym. Like, I miss my people. And then leading up to my surgery, I was terrified. Like, they're going to literally cut my neck open and move vital things out of the way and put this new disc in me. Like, it was the ultimate test in letting go, because I'm not a neurosurgeon. I don't know how to do this. I don't even know how to do the rehab for it because there's nothing out there. So I had no choice but to let go and let people around me help. And so I think when we're working with patients, especially for PTs who've never been injured, like, again, fingers crossed and God bless you that you haven't been, you have to really try to empathize and understand your patients and make sure that you are part of that support system. Like with the guy you had this morning that, he's doing acceleration, deceleration. He probably knew driving to PT this morning that he was going to work on that. And he's like, hell yeah, I'm going to crush this. And then he gets in and he's like, oh shit, I'm not.
Yeah. It's funny how that goes.
It is.
And to your point too, ultimately your locus of control was completely disrupted. One day you could do whatever the heck you wanted. You could lift, you could pick up your son, you could hug people, you can do anything. And then the next day that's completely gone. So ultimately, finding ways to give you control back. It might not be total control. Here's the keys, take off and run. But any little thing you can do to restore control of someone's life, I think, is essential. You also brought up a great point of how you felt like it's very easy to slip back into past habits or past things. Maston Kipp calls it a survival pattern, and I love the term. It's something that we use to keep us alive and get through difficult times. However, just because we're surviving does not mean that we are thriving. And it's one of those things that it is so difficult in the moment to be aware of those things that we're doing. You mentioned it yourself, it's very, you had, I think you used the term a bit of a temper for a long period of time, and it's very difficult to sometimes be in the moment and step back from a situation and understand what you're doing, what's going on around you. And I think that over time, cultivating the ability to do that is a great skill for anyone, but it doesn't change the fact that it's almost next to impossible to do it every time, right? We always have to be willing to accept the fact that we're not going to be perfect at our ability to step back, assess our situation, assess our emotions, and how we're acting as a result of them. It's so difficult to do. And then going a step further, in your case as well, I can't help but think about how many other people may not be living the exact same thing that you're describing right now, but have gone through something similar. And yet, no one recognizes it. I mean, there was that same year I met you when I was in Arizona, there was another girl I met out there. We had her on the podcast, actually, Emily White. She was in a freak four-wheeler accident up in Flagstaff, Arizona, and in the middle of COVID nonetheless, and crushed her leg, had like 5 or 6 surgeries, ended up eventually choosing herself at 20 years old in a hospital alone in the middle of COVID because no outside visitors, to have her leg amputated. And then less than a year later, returned to the college softball diamond, with a blade for a leg. Like, it's just amazing to me how many stories like this are out there of people who have really gone through hell and back and yet continue to strive through adversity and continue to push forward on the day-to-day, such as yourself here. And I think that at the end of the day, stories like yours need to be told more, need to be shared more, and need to be spotlighted more, because this stuff is not getting enough attention. And unfortunately, there's too much trauma going around and not enough people talking about the long-term implications of it.
I think that trauma, I love and I hate the word, like people, because it can be so used so poorly where, somebody, their Starbucks order gets messed up and they're like, oh, I was traumatized because I didn't get the right coffee this morning. Well, actually, you know what? You weren't traumatized, you were inconvenienced. But at the same time, trauma is the person's perspective of what happened. And so, what happened to, like, think about my son and I. My son was in the same car that I was in, and he had no problem getting back into a car the next day. I had to go pick up the rental car and I was like, oh my God, I don't want to drive. So it's all about your perception of the event. But I think that one thing, hopefully we're starting to do better as healthcare providers. I know our program does this. I think a lot of other programs have psychosocial components to their program. Every single person who comes to see us, because we haven't really advanced our profession to such a point where people are coming to see us preventatively like they would their dentist. Perhaps that's another podcast. But when people come to see us, they're coming to see us because they're hurt. Something is hurting. And pain is actually an emotion. Like, there is some physiology associated with pain, but the perception of pain is an emotion, just like love or passion or hatred or anger. It's all emotional. What pain does, though, is that it takes us out of the present and into that survival mode that you were just talking about. And so one of the things that I think really was able to help me in this process is something called somatic experiencing. So I'm actually in the middle of my somatic experiencing training. I'm in my second year, and it's a trauma intervention that was developed by Peter Levine, and it helps, it gives the person tools to help themselves. So you end up, and I think it's really helpful for PTs because you're teaching patients how to track things that they're feeling in their body and around them. And so when we find ourselves in this kind of, slipping back into an old pattern, one of the things that I do, I can figure out, I know where in my body I start to feel something when that happens. So I end up getting this, I call it my column. So I'll have this area from my sternum to my belly button that feels like a tower or a column of just tightness. And when I feel that, my job is to immediately orient myself to my surroundings. And when we stop and we can orient ourselves to our surroundings, it brings us into the present moment. And it might be something as silly as right now, I'm, sitting in this little part of our breakfast nook kitchen area. So if I'm stressing out, I can look around and I can be like, okay, coffee cup, chair, coffee pot, bananas. And I'm just pointing things out around me, and that gets me into the present moment. And then I can come back into my body and come back into my breath, and my nervous system will start to calm down.
Right. I love that. Kind of like we talked about before, being able to take a breath, step back from a situation, and become aware of the situation around you and what's happening. And again, that's a very difficult thing to do, but if you develop the ability to do it, I would imagine it helps you quite a bit, for lack of a better way to put it.
It does. And it's not perfect. There are times that I can't catch it in time, and that's when I lose my temper. But if I catch it in time, and if I can tell, if I'm at home and I can tell my husband, you know what, I need a minute, I can just remove myself from the conversation, remove myself from the room, go get calm, and then come. And then I'm back online. I can actually make sense and hear what somebody's trying to tell me. And, I actually do the same thing with our son. This weekend, my husband was gone on drill again, and it was just my son and I. And there were a couple moments where he was unglued, and my job as a parent is to stay calm and be supportive for my child when they're having a hard time. And I can't do that all the time. And so sometimes I have to just tell him, I love you. I need to go take a break. I will be right back. And I always come back, and then we can kind of regulate one another. You have to be able to communicate with people when you're coming unglued and before you walk away. If you can do that, if you can catch that, then the rest just takes practice. Again, you just move the needle 1% every day. And then, over a period of time, you've got this new habit. And it's not perfect. No, it will never, to go back to perfection, it will never be perfect. But if I focus every day on how to do that, then I've made a little bit of a difference.
I completely agree. And your 1% continues to add up for you right now, Meghan. As you mentioned, you're already back to squatting and deadlifting, and before you know it, you'll be competing again in CrossFit, which I'm excited to see that happen for you. And I'm excited to see, this one piece of your life. And, relatively speaking, it ends up becoming a small piece when you look at the past 42, 43 years.
Yeah.
So I'm interested to see what kind of impact this has for you moving forward, because I have a feeling that, from what I know about you, you're really just getting started here. And next thing you know, you could be, the first ever female to win a CrossFit competition after a neck surgery or something along those lines. You ultimately take what has happened to you and find a way to work it into the greater good of your life. And, you're not someone who settles for what has happened to you. You choose to become what you want to become as a result of it. And I think that's something we can all kind of reflect on and take away for our own lives. Because as you mentioned, sometimes we get these minor little daily hiccups and inconveniences that might feel a little more traumatic than they actually are, that in the grand scheme of things do not shake our world up. significantly, for lack of a better way to put it. I know we're kind of running short on time, but is there any kind of closing thoughts or closing remarks or anything else that you wanted to share today?
I guess I do want to say, relative to competing in CrossFit again, I am retired.
Really?
Yep, I am. I think that's a big thing that I learned from this injury, and I had kind of thought about it before this happened anyway. Training for that took so much away from my family and from my life, and there were some weeks that I think I was training probably 25-30 hours a week, and it just was too much, and it didn't leave anything for myself, and it didn't leave anything for my family. And so what I realized is that I loved competing in CrossFit. I love Olympic lifting. Like I still get to do those things. If I want to do a local competition, that's fine. But I don't get, like, today is the youngest my son will ever be. And I don't want to miss that. So I would rather pick him up early from school. Like, I get up now and go to the gym early in the morning so that I've got the rest of the day. I would rather pick him up early from school and play with him outside, or play a game, or, just let him kind of guide me. I would rather spend time with my husband. It really made me stop and think, like, where are your priorities? And my priorities are with my family. And so, I think consistent reevaluation of what your why is would be my parting thoughts. If you're a student, if you're a physical therapist, if you're, I think you've got people who are trainers and coaches and stuff that listen to your podcast too, at least once a month or once a quarter, just carve out some time and, like, get yourself outside, get your feet in the grass, and really stop and think about what your why is, because it's okay for it to change. And that's when that the universe is calling you in the direction that you're supposed to go. And so that's kind of where I am. I'll still do CrossFit and lift, because I love how cool it feels to be strong. But my days of competing and letting that define me are done.
Yeah.
There's a lot of other people who are way better at it than I am.
I can relate to you there. I mean, I can't even believe some of the stuff that you can still do, Meghan, because, I myself, I never got into the Olympic lifting or that sort of thing, and things like the clean and jerk and all of those different things have always really impressed me. And it's not just your physical ability, but the way that you can take something like that and then break it down into such simple terms to the level that anyone can understand it. I mean, I still remember some of the different things that you would explain, and I was just like, why the hell did I never think about it like that before? So I really, really appreciate your time, and I really appreciate all the insight that you've shared and your overall journey. Ultimately you grow through what you go through. Here's another cliche term. I'm full of them
Absolutely.
today.
No, I love that one.
But
good one.
I think that your experience is very impactful, and I just can't, even begin to, assume how many people you're going to impact just by sharing your own story and experience. And, at the end of the day, that 1% thing we talked about earlier, that was all in reference to ourselves. But if we can just impact one person a day, the effect that we can have on the world is just going to be exponentially more than anything we can ever think of. So I really appreciate you, your time, and everything that you do, Meghan.
Yeah, thank you for having me. This was wonderful.
Oh, and for people who want to find out more about you, where can they find you? Or, 42, 43, is that still the MySpace era? Or
I did have a MySpace account. I did. So I am actually on Instagram as It Depends DPT these days. I am in terms of, can I change 1%? I'm trying to change the PT education world one person at a time. So that's where you can find me. And then I also, I had a long stint as a pelvic health therapist. So I also have a website called Fortis Matram, FORTISMATREM.com. And that is Latin for strong mother. And then, if you're a PT student, or if you want to go to PT school, and you want a pretty awesome program, check out Franklin Pierce University in New Hampshire. Got to
For
plug my
sure.
own program. Yeah.
We will we'll link to all of that below in the description too. So if you didn't quite catch it, you can just click it there. Meghan, thanks again.
Yeah, thank you.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.